Welcome to my channel, Women's Health. In this channel, I'll be discussing about health issues that concerns women during pregnancy and outside pregnancy. If you've not subscribed to my channel, please subscribe and tap on the bell to get notifications anytime I post. In this episode, I'll be talking about sex during pregnancy. Sex is generally safe during pregnancy and it doesn't affect your unborn child unless you have an underlying health issue. In this episode, I'll be mentioning some times that sex are not allowed during pregnancy, and also I'll be answering some questions about sex during pregnancy. Rising and falling of hormone during pregnancy might affect your desire and interest for sex. Make sure you communicate with your partner whatever you're feeling, and also let your partner know what feels right and what doesn't feel right about sex while you are pregnant. And also, if you have a low sex drive or you have no interest for sex during pregnancy, make sure you connect to your partner in other romantic ways so that you can keep the bond going. You can During the later stage of pregnancy, you might experience a mild contraction after sex. But these contractions are nothing to worry about because they go away quickly and they don't stay long. But if you experience a contraction after sex that stays long, make sure you talk to your healthcare provider about it. Now let's look at sex through trimesters. In your first trimester, you might experience a low sex drive due to pregnancy discomfort such as nausea, tiredness, sore breast, and even hyperemesis. And in your second trimester, you might tend to have an increase in sex drive, and sometimes it might even go higher than what you have during your pre-pregnancy stage. And in the third trimester, you might experience a low sex drive again due to the size of the bump, which makes you uncomfortable to lie down in some certain positions. And also, the thought of birth preparedness might tend to affect your interest for sex. Now, let's answer some questions about sex during pregnancy. The first question I have here is, can sex during pregnancy cause a miscarriage? No, sex during pregnancy cannot cause a miscarriage unless you have an underlying health condition that might trigger a miscarriage. And what is a miscarriage? A miscarriage is a sudden loss of pregnancy before 20 weeks of gestation. And most miscarriages occur as a result of the baby not developing well. So, sex is safe during pregnancy and cannot lead to a miscarriage unless you have an underlying health condition. Now, the second question is, what is the best sex position during pregnancy? Any position that makes you feel comfortable is okay during pregnancy, except in the third trimester, while lying on your back is not advised at all to have sex because you might be applying pressure on your major blood vessels, which can lead to some medical complications. So, any position except that is allowed during pregnancy in all stages except in the third trimester when the bump is fully grown, and lying on the back might apply pressure to major blood vessels. Otherwise, any other position is safe to have sex during pregnancy. The third question is, are condoms needed to have sex during pregnancy? You don't need a condom to have sex during pregnancy unless your partner has a sexually transmitted disease. In this condition, you might need to use a condom to prevent being infected and also to protect your unborn child. Question number 4 is, can sex during pregnancy cause a preterm labor? No, sex during pregnancy cannot lead to a preterm labor unless you have an incompetent cervix. What is an incompetent cervix? It's a situation where your cervix opens prematurely before time. In this condition, it might trigger a preterm labor. And question number 5 is, what are the benefits of sex during pregnancy? During pregnancy, sex has some benefits, which is number 1, it can create bond between you and your partner. It helps to improve sleep and it helps to boost your mood, making you feel having a feeling of joy and love. And question number 6 is, when are the times that sex are not allowed during pregnancy? There are certain times that it is disliked to have sex while you are pregnant if you have this condition. First is vaginal bleeding. If you have any sort of vaginal bleeding during pregnancy, you might be asked to resist having sex during that pregnancy. And second is the leaking amniotic fluid. when you have your fluid leaking out, you might be asked not to have sex during pregnancy in order to prevent the risk of infection to you and your unborn child. And thirdly is incompetent cervix. When your cervix opens prematurely, you might not be allowed to have sex during pregnancy. And if you have history of preterm labor, you might not be allowed to have sex during pregnancy in order not to trigger this situation. And the third, another reason why you might not have sex during pregnancy is placenta previa. Placenta previa is when your placenta covers the opening of your cervix partly or wholly. It might cover part of the opening of your cervix and it might cover the whole opening of your cervix. And when you have sex with this condition, it might trigger bleeding. And the next time you might not have sex during, you might not be allowed to have sex during pregnancy is when your partner has a sexually transmitted disease. And in this case, if you want to have sex, you must use a condom in order to protect you and your unborn child. And another time that you might not be allowed to have sex during pregnancy is when you are carrying a multiple pregnancy. Maybe you are carrying two or more babies. You might not be allowed to have sex during pregnancy in order to prevent preterm labor. I hope this video was helpful. Thank you for watching. And if you've not subscribed, please subscribe and tap on the bell so you don't miss out on my next episode where I'll be talking about the common mistakes to avoid during pregnancy.